Welcome to the Heart of Health and Science. It's a podcast designed for people who have been in the healthcare field for many years and people considering entering the healthcare field. Today we're going to be talking about what is required to be in healthcare. What are managers and hiring people looking for in a candidate that's coming into the healthcare field? So first off, right off the bat, I want to introduce our guests today. First off, we have Amanda Tucker, who is a nurse manager at Liberty Hospital, and we have Jessica Ewing, the Human Resources Manager, also at Liberty Hospital. So welcome today. I just want to jump right in because we have so much really cool things to cover today. So starting off, I want to talk with you. Amanda, let you introduce yourself, tell us a little bit about yourself, what brought you to Liberty even, and things that you really value about healthcare.
My name's Amanda Tucker. I am the nurse manager of 3 East, which is one of the medical floors at Liberty Hospital. I have been there a little over a year now as the nurse manager. I have previous roles under my belt as nurse managers in other areas, floor nursing, quality, all kinds of different things in the past, but all within the nursing realm, which I love. Nursing's so great. There's so much in healthcare that you can do. I don't know what I would be doing if I wasn't a nurse. Yeah. And I feel like I'm just so lucky that I have grown into being able to help other nurses take on those same roles, be hired within organizations, get to where they want to be and find their passion.
Nursing leadership is truly one of my top 3 passions. One of my other ones is my family, certainly. And I often say that nurses are providing care to the patients that they're serving, and they're providing care to and for. They also have needs themselves. Sometimes they're having a crisis, a personal crisis of their own. And my role, your role, allows us to be the nurse to the nurses, which is the most amazing role, I think, that's out there.
Yep.
I really do.
Agreed.
Jess, that brings us to you. You are the front door of the hospital. So tell us a little bit about what you do and how long you've been at Liberty and what brought you to us.
I am our manager of talent development here at Liberty. I oversee the full employee life cycle from entry to, offboarding, whether that's, somebody wants to leave on their own for new career opportunities or any of those other circumstances. And I've been with Liberty for a little over 9 years now. And it's an interesting thing in terms of how I got into healthcare. I didn't have a passion for nursing per se. And I didn't know that I would want to work in a hospital. That wasn't really on my list. I think I had kind of planned and set myself up to be in business. I started as a finance major. And once I got into that in college and just kind of saw what that industry was like, it didn't feel fulfilling. And so I made a change in my major. And at the same time I was making that change in my major, I also applied for a PRN position at Liberty Hospital just to kind of make ends meet while I have my small family at home and pursue this new degree path. And I fell in love with human resources because I too like to care for people, just not in a setting that's clinical. That's a little scary to me. But to find a place where I get to care for people who care for the people who care for the people, that's been so fulfilling. And I don't know that now that I've sat in HR in a hospital, I don't know that I would look in a corporate setting because it's just so special to be able to work alongside nursing leadership and those others that are in care of others and be able to take care of them.
So one of the things that you do pretty regularly, pretty routinely, is screen applicants. Yeah. So people out and about, they look on our website and they see open positions in the organization and they apply for whatever position. You get to see those. What are the things that you are looking for right off the bat? So you see them before they're then sent on to the other leaders in the organization. Sure. So what are you looking for in the qualities? Is it the education only? Is it the skill set only? I'll stop asking the same question. What is it that you're looking for in a candidate for the organization?
Yeah, I think maybe I have a little bit of a broader lens because I get to see all of the applicants for all of the many positions that it takes to operate a hospital and care for the folks there. And so I definitely think I wouldn't say one specific thing. It's position specific or area specific. But what I'm really interested in is in how folks are communicating on their application about their previous employer. What are they saying about that? How are they framing those things? What are they looking for? And is this, based on what I know about the position or about the unit, do those things really align? I'm looking for alignment in strengths and culture. And you don't always get to see those things on paper, but I'm looking for something that sparks an interest where I know that they want to be here. I think it's important to want to be at a hospital because it's not just a job when we work in a hospital. It's not just a job to come and take care of people. And so you have to want to be there. And those are the things that I'm looking for. And then beyond that, working with our leaders across the organization to understand their specific needs for the unit, because that changes over time. You might need a highly skilled person who has many years of experience to fill a vacancy, and a month later you have another opening, and you don't need that level of experience or expertise. You have some capacity to train up and upskill. And so I think it's really individualized when we're looking at that specific unit, that specific need, and then making sure that it's a great fit, not only for the unit, but for the organization and for the candidate. Ultimately, we want people to thrive in the organization.
Yeah. I recently heard an interesting story about you. Actually, it was on a previous podcast, and someone that works very closely with you said that she had an opportunity to be a basketball coach for a young basketball team. And she didn't know if it would interfere with her workplace or not. And so she came to you, her upline, and said, I have this opportunity. I'd really like to do it. Do you think it's possible with balancing that out with my work? If it's not, that's fine. And your answer to her absolutely backs up everything that you're saying so far. She said that your answer was, if it's important to you, then it's important to us, and we will make that happen. And I think that is the most perfect answer. Really impressed by that, because that really speaks to the heart of the type of organization that Liberty Hospital is. Anybody who has any interest whatsoever in healthcare should want to come here because of leaders just like you, that you just demonstrated to that employee. If it's important to you, it's important to, if it's important to you, the employee, it's important to you as the leader, that's a perfect way to describe the culture, I think. So kudos to you. Kudos to you. So Amanda, when Jess gets done screening those and figuring out if that application is one, and the person behind that application is one that would fit within our organization, if it's any clinical type of person at all, whether a unit secretary, a CNA, or a patient care tech, or a registered nurse, or even an LPN. Those then could be sent your way. And then you start looking at that application and trying to learn a little bit about the person behind that application. So same question, what type of qualities are you looking for when you first put eyes on that application?
So basically the same thing. She couldn't have said it better as far as the type of applicant we want. We had discussed, Jess and I actually discussed when looking at candidates, what kinds of things we're looking for as far as skills or how they'll mesh with your team and that kind of thing. And really, we like the skills to be there for sure, but it's more important, how are they going to work with the team? How are they going to communicate? How are they going to communicate with the patients? What does that look like for them? And how can you see the compassion coming from them even when you're just having that first initial conversation? Is it something they want to do? Is it something that they're passionate about? Whether they've done it for, clinicals only, and then this is their first rollout of it, or if they've done it for 5 years and they just want to continue on. So very similar to what Jess said, yes. And sometimes that's harder to see on paper, but sometimes you can pick some of those things out, like teams that they've been on before, things other than just their work history brings that out as well. And then, of course, then asking those types of questions when you meet them in person.
One of the things that I love reading about is all of the different generations in the workforce. I read about it frequently. At least once or twice a week, I'm in an article about that, because there are at any given time 4 different generations that are in the workforce. And if we're leaders in that setting, we need to be able to communicate effectively with whichever generation that person belongs to. And I think it's fascinating work, but it also requires us to change very frequently in how we not just deliver care, but how we narrate the care that we're delivering and how we narrate what we're looking for an applicant to come in. So when we're out there recruiting and saying, hey, have a look at us, we're the best kept secret in the Northland, come have a look at us. What are recruitment things that you've been part of, and how do you think recruiting requirements have changed over the time that you've been here, even in that amount of time?
Yeah. I think that there are a lot of external factors outside of healthcare that are just happening to people in the world, right? We have different political environments. We have different economies. There's so much that's going on that influences how people need to make decisions that are best for themselves, and we want people to show up as the best version of themselves to care for others. And so, what I have seen be most effective for Liberty Hospital is that community aspect. What I've seen in the most recent generation, and maybe fact check me, but I've seen this sense of like purpose and wanting to be super connected to the work that they do, not only to feel like they do a good job, but to fill their own cup. And I would say being able to work and live in Liberty, we're really embedded in the community, and we're really embedded in the schools and with the Liberty Foundation, Liberty Hospital Foundation, and some of these other groups. And because of that, I think people, especially those that are new to the field or graduating and coming into healthcare, they want a sense of community and that sense of belonging. And I think we've done a really nice job. You've done a really nice job coming in and building that sense of belonging for them so that they feel like they're at home, in a sense, right?
Mm-hmm. I frequently say that I am at work more than I'm at home. And if I am with my work family more than I'm with my physical family, then I really need to enjoy what I'm doing, and I need to really feel plugged in there. Otherwise it's just a job. And I don't necessarily look forward to coming to just a job. Mm-hmm. I truly am that person that when it's time to get out of bed, which I resist every day, by the way, when it's time to get out of bed, when I know that I'm getting out of bed and I'm going to work, I'm yet to have a day while at Liberty Hospital where I say, oh, I have to go to work today. It's just, once I get the sleepy out, I get to go to work. And I get to do really great things because here we allow that. And it's not every organization that does that. We allow excellence to happen. And we encourage people to be, as you said, I wrote that down, to be the best version of themselves. Because I want to see the best version of all those that I'm working alongside. And I want them to be able to see the best of me. And hopefully we all deliver that every day. One of the things that is in our workplace formula is everything we do is designed around the people in our organization. First, the people that work in the organization, are their needs being met? Or do they feel home, to use your words, when they're there, when they are at work? Do they feel as though it's a valuable use of their time while away from their family? And are we showing up every day? Showing up. One of the things on that formula also says we no longer have bad days. And that doesn't mean we don't personally have a bad day or it's a really tough day at work. It just means if I have a flat tire and I'm an hour late because, me on the side of the road trying to do something to a tire, it's just not a pretty thing to even think about. It's just not. But by the time I get that tire fixed, I'm frustrated. I'm late. I feel like I'm chasing myself around, but that's my experience. But when I come in and I show up, I need to show the best version of myself. We need to do something with that. That's a great line. I think we have an obligation to those that we're serving alongside, not necessarily just in the clinical space, but those that we serve every day in any capacity to see the best of us. And our bad day needs to be put aside while we're working with people. Anyway, I could talk about that for ages and ages and ages.
But hopefully, if you have that right team and that perfect team, by the time you get there, they've covered and helped with everything anyway.
Yeah.
So all that worry is just gone.
Yeah.
And you're just starting your day as if you just got there.
On time.
Yeah.
Yeah, you're right. And I think by and large, that's the way that it is. And very deliberately, very intentionally. I have become very protective of the culture that we've worked really hard to establish. And so when I'm part of the inviting somebody to join any one of the teams, I really am looking for a certain fit. That's that cultural fit. How do you find that? How do you, when you see an application and you're talking with that candidate, how do you really flesh out whether this is a cultural fit and someone that would fit within your team? I'll start with you.
I think there's a few different ways to do that. Normally, when we have a candidate that's interested in working on 3 East, then I go through a couple of questions with them, more or less just to kind of get input from them on where they live culturally, their thoughts around teamwork, all of that. And then I schedule a second time for them to come in and be with the team. So they spend some time getting to know if it's a day shift applicant, usually during the day, if it's a night shift position applicant, then on night shift, and they'll come in and spend that time with the charge nurse. If it's a PCT, then we usually pair them with the PCT. If it's a nurse. And then they ask all kinds of questions. Then that way the PCT on the floor or the nurse on the floor can ask questions too, just about them, get to know them, find out, do they think they'd be a good fit for our unit as well?
Yeah. Yeah, it takes quite a bit of time to flesh that out. I love the shadow shifts that you just described.
Yeah.
That way they can see us in action and they can see if they want to be part of that energy that is in that particular department. Same question for you, Jess.
Yeah, I would just play off of, what Amanda shared. I love the shadow opportunity. I think it's the best way to really see it in real time. And, as much as we're interviewing people, they're interviewing us as well. And we have to account for that because we also, it's hard to explain exactly what we do day in and day out from a job description or a piece of paper. And so to see that and feel that and be able to have conversation with the teams and really kind of see that in a trial run, essentially, I think is great. I love the peer interviewing piece as well because, they're the folks that are going to help bring this person along and grow them and educate them too. The manager has a role in that, but at the end of the day, they're working with these people on the floor. And so I think that's a really important piece to get buy-in from the team so that they can actively participate and again, like create that sense of belonging. And so for me, before I ever get to that point, because I'm typically not involved in panel interviews or shadowing, I'm asking those questions about like, what is your why? What's driving you beyond I live close, I've heard great things, specifically like what is it about the work that you want to do and why do you think that's a great fit here? And then, sometimes I'll share about the great work, the educational programs, the work that we've done, some projects and some successes, things like are really challenging times too, our downtime. Here's how our team functions together. Like, does that sound like a place that, works for you? Does that meet kind of what you're looking for too? Then from there, bringing them into those shadows, bringing them forward to our managers, presenting them from there.
When people apply for a role, they come in with a certain amount of experience. It could be just school as an experience, or it could be long-term experience or anything in between. I had the opportunity to talk with someone who had interviewed for a position, ultimately was not selected for that position. And that person came back and said, what could I have done differently? What is it that you see that I need to do to be able to be selected for this position or a position like it in the future, which I thought was a great question. And I said, the experience that's required for this position, it's not necessarily in years, but it's in the type of work that's required. And oftentimes it does take years to get really just intuitive at that kind of work. And the response that was given to me, and I have thought so much about it, was Everyone comes with a certain level of experience. The person that was ultimately selected for that role had a lot more years of experience than I have. But all experience isn't necessarily good experience. And the experience that I do have that I brought, it matches what this job is requiring. I don't know if that experience does. So I just want you to remember that it may not be all about years of experience, but it's about the type of experience. And I've thought a lot about that, the relevant experience versus the years of experience. And I know that you both have to flesh that out a lot. So when someone does get past all of the screening and all of the application process, and they start on your team, what are the types of things that you like to do to acclimate them to the team to make sure that they have their best opportunities and the best opportunity for success?
Yeah.
I'll start with you on that one, Jess.
Okay. I like to ensure that they have time to spend with every team member, learning and understanding what they do. I think it's so important to come into a new place, and granted, my work is different. And so coming in and understanding the way that it works and the why, and then meeting with them regularly and really walking them through some of those things and talking about like the quality and level of service is really important.
Yeah.
And so, for some of my positions, I enjoy bringing them into these higher level meetings that I have so that they can observe and hear the conversation and be a part of that. And that's a luxury. I recognize that in the type of work that I do. But I just think when you can find those settings where they can observe and hear and absorb and not necessarily have to be doing the task or feel performative, that can be really beneficial. But then really just spending time with them. They need that time with their leader or with their preceptor in those first 90 days, 6 months, to really be successful, and making it comfortable for them to ask questions. And people can get into the role and feel like they're a burden because they're slowing people down. And we have to do a really good job of showing patience and understanding and not making them feel that way. And so any opportunity that we get to display that, I think, is what I have found a lot of value in and a lot of success in.
Yeah. Yeah. So same question for you, Amanda. And also, since you are in nursing, with nursing, we do have the nurse residency program that also provides a year of additional team building with nurses from all over the organization. And it allows them to grow together as new nurses together. So same question for you. Once someone joins your team, what are some type of things that you like to do to make sure that they are truly acclimated to that team?
Similar to what Jess said, we have a check-in with all staff members, and we do a little bit more with the nursing team, new grads when they start. But we have a day one check-in, so day one being the first day on the floor. About halfway to 7/8 of the way through their shift, we will, usually myself, sometimes the nurse supervisor, Ashley, will help as well, do a check-in and find out how are things going on day one? What's going well? Is there anything that's not going well? Task-wise, I usually ask about their overall experience with house-wide orientation as well during that first check-in. And then I always move into the people. So how has it been with the other PCTs? How has it been with the nurses? How's it been with the charge nurse? Have you had good interactions, been able to ask good questions? Is there anything you need more of? That kind of thing. So we do that from day one. We also do it at week 1 and then week 2, the 30, 60, and 90-day marker. Of course, we always see each other in between then, and I usually check in, but those are the formal ones that I have written down. And then as far as, talking about being leaders and wanting to grow others and that sort of thing, with the nurses, what I will do is I will have them go and be with other areas in the hospital too. So the nurses will spend a couple of hours with the nursing resource office, also with lab, pharmacy, environmental services, so they can just kind of see everything that everyone does, just so that, not so that they learn the job, but so that they're knowledgeable about, okay, well, that room took an hour to clean. Well, they know the why behind everything that is done, or that medication, it took 20 minutes for it to arrive, and they might know more of the flow of what took that time for it to get there.
Right.
So lots of different things throughout their experience and check-ins and that sort of thing, so that they know we're their second family, we're there to help them grow, we're there for them.
Yeah. So when you're looking for the ideal candidate, what would that look like?
I would say someone that you can tell that that passion and that drive is there for doing that work, whether it's the patient care tech or the nurse. We talked briefly earlier about skill, and although that's nice to have, that's not my number one. My number one is, do you want to come in and be a part of a team? Do you want to work to the best of your ability, make the patients' lives better while they're here, and take good care of them? And so that's what I kind of focus it more on than their previous experience, especially if they're newer too and wanting to get into healthcare also.
So just what type of advice would you give to someone saying, I don't know if I want to go into healthcare, anything in a hospital setting? I'm not sure. What type of advice would you give them?
Yeah, I think I would encourage them to explore their why, because healthcare is great, and I love healthcare, and I love working with you guys. It's also hard work. It's challenging work. You have to be resilient, and you have to know that about yourself. And so I wouldn't say it's a career that you should just step into on a whim. I've seen the heartbreak in somebody going through a nursing program or an adjacent program, and getting into it and it not being what they thought it was, and feeling like they failed or they wasted their time and their money. And so, I never want anybody to feel like that. And I would just encourage them to really kind of think about what it is that they want to do long term, and what values do they have. And it's okay that that's not the same for everybody. Sometimes people want to climb a corporate ladder, or sometimes people want, just a clock in and clock out type of role based on the season of their life. And that's okay. But just kind of understanding and knowing where you're at. And then for healthcare, you have to have a passion for people. In any department that you work in, you have to care for caring for others. And so if those are the things that you enjoy, come on, we want you. We'll bring you in. We'll bring you alongside. We'll grow those skills that you might not have. We'll help you find programs, but make sure that, that number one thing, that number one priority is caring for others.
Yeah. And you started out by talking about how you initially were going into finance.
Yeah.
I really appreciate it when people do, but I can't imagine it myself. I can't imagine it staring at spreadsheets. And I know that there's much, much more to it.
Sure.
But we have that opportunity.
We do.
At the hospital.
We do.
And so if people come in and they want to go into that business side, we have that.
We do.
And so it's not only clinical. I mean, that's the world I live in for the most part. It's not only clinical, but it's everything about a business of hospitals. And there is definitely a business of hospitals.
There is.
So, okay, I want to bring us to the final question. Can you believe we're already there of our time together today? And that is, during your time at Liberty Hospital or throughout your career, what is your favorite story about something that you've experienced in your role in nursing anytime, in nursing leadership, in human resources, any part of that? What is your favorite story? I think it's a tough question, but it's honestly my favorite, because the stories that come up here are just so good. No pressure.
I know, right? I would have to say, since I came to Liberty, I had a nurse who she was telling me a story of, she had a patient that actually the patient and his wife had been at the hospital on the same floor, on our floor. They had gotten admitted. They came from home. They were admitted, and the wife was discharged and sent to like a long-term care facility. The husband stayed along in the hospital because he wasn't ready to discharge. Once he was, I think it was that the facility she went to could not meet his needs, so they had to send him to another facility. Oh. So that gentleman ended up coming back, being admitted to the hospital again, talked to the nurse about his the story of what had happened. And she said, well, I bet we can get you there. And went and talked to care management and came up with this big plan. And he was able to be discharged to the facility that the wife was so that they could be together again. And I thought, that is the cutest story, but also I feel like the story of so many of our nurses on the floor. On our unit, they all care so much about their patients as if they are a second family a lot, and are willing to go out of their way to make things like that happen for their lives. So when I heard that story, I thought that sounds just like 3 East, and I love being here. So
Yeah, that's the heart. That's the heart of it right there.
yeah.
It's stepping out beyond ourselves. I love that story. I love that. Same question. You don't get to share a clinical story, so this one's going to be fun, I'm sure.
Okay, I think I have two. One is very short. Within my first couple of weeks, I'm not clinical. I don't have those skills, but sometimes I get the pleasure of helping patients. And I helped this sweet older lady who was having trouble walking to the bathroom. And, that's such a small gesture, but like helping her navigate one, and then getting there. And then I waited outside, and she was like, oh my gosh, you didn't need to wait for me, but thank you so much. And I walked her to the place, and like that just kind of like sealed the deal for me to stay, because that was within the first several weeks. And I was like, oh my gosh, this is heaven. Like I could do this all the time.
But those gestures make such a difference. They really do.
They really do.
I totally understand what you're saying.
They really do. And it's just that small piece of caring for our patients or our families that I get to play a part in. The other one I think that really stands out to me is I love developing internal talent, and I've had the pleasure of working with you on our Emerging Leaders program, and I have loved that. And I think the best part about that is seeing our staff find themselves in those programs. And then when we have those graduations, they bring their friends and their family. And so I've had the pleasure of meeting like somebody's husband and their children, and they're so proud in that moment. And then they go on and they're emailing me or they're calling me and saying, Jess, I got this next job. And that is just, that's the other reason why I'm here.
Yeah.
Stay and do that.
Yeah. I get it.
It's
I
fabulous.
I really do. I frequently say that in hospital settings in healthcare, when I say that, I don't mean just the clinical setting.
Sure.
But we get to be present in the memories of people forever. And in the clinical space, the story that you just shared, that family will remember that forever. That the staff at 3 East and Liberty Hospital, they worked diligently and tirelessly to make sure mom and dad, grandma, grandpa were together. That's absolutely beautiful. And the Emerging Leaders class, which I agree, it's a fantastic opportunity for people. You get to be part of their memory. The reason I go into leadership is because of this person named Jess Ewing, who encouraged me and brought me to a place that was safe to ask questions and just poured into me. And all these years later, she is my foundation. I mean, you will be part of the memory of those people forever. And you can't beat that, and if we get to bring our best self every day, we get to be a good memory for those people forever. And you can't beat that. Why would people not want to go into healthcare in a healthcare setting? Again, not just the clinical space, but my goodness, in any part of healthcare, in a healthcare organization, you have the opportunity to meet people where they are and help them be in a better place than they were prior to meeting you.
Yeah.
You can't beat it. You can't beat it. So any of you that are able to watch and listen today, you also want to be in healthcare. Why would you not want to be in healthcare? So I want to encourage you. If you ever wanted to think about or consider joining a healthcare organization, have a look at us here at Liberty and come talk to Jess. And she can help direct you and guide you and tell you the steps that you need to take in order to be able to join the team. So until next time, thank you so much for watching. And you take care of you, and you be a good memory to other people every day.